Welcome to the second ever episode of the Movement Revisionist podcast, where I help you redefine human movement. Still coming up with a slogan. I don't know what I'm going to do just yet.
Working title?
Yeah, it's a working title. But today I have the wonderful Kristin Szlinis. Am I saying that correctly?
Close enough.
I always mess it up. Well, we know each other very well because we work at the same exact location, but she is a licensed massage therapist, but also a certified Rolfer, or commonly known as structural integration. But I have you on the podcast to discuss what the heck is the difference between massage, bodywork, and Rolfing, okay? But before we get to those, let's just have you introduce yourself, where people can find you, social handles, all that fun stuff.
Hi everybody, I'm Kristin Szlinis.
Close. I was close.
Wise Body Solutions. You can find me at Wise Body Solutions on Instagram. You can find me at wisebodysolutions.com on the internet, or inside the Reach Rehab and Chiropractic office in Plymouth, Michigan.
ReachChiro.com. All right. Well, let's just talk about how long you've been in the biz.
You know, I had to do the math the other day. It's been almost 17 years.
17 years? Whew.
Been around the block.
Time flies. And then how long have you been a certified Rolfer?
So I went through that certification in 2015, 2016. So 2016 to now would be 6 years, 7 years?
Time is flying.
It does.
You met me when I was just an intern, when I was still a student. And
when you didn't know very much.
No, I didn't. Still don't. Well, I know enough to get by, but it's funny how time flies. And for those watching, you are with child.
Yes.
As we say.
Yes, I am growing a human.
Yes. Can you pack more of a punch now that you got a little bit more mass behind that for us?
I did have
I say that in the nicest way possible, by the way.
I did have a client tell me that now that I have more body mass, I have more pressure on them as well. So I think he has been affectionately referred to as Jose Grande until he has an official name. I think Jose Grande does give me a little more punch.
Nice. Better than Nacho Grande, I guess.
I hadn't considered that as an option yet.
What makes you feel more full in the stomach, you know?
Oh, well.
Well, we digress. But let's just start with, because obviously I really want to get into Rolfing, and we co-manage a lot of people together. And what you do coincides with what I do in my clinic room. But let's just start with the basics. What is traditional massage therapy to you? Gosh,
okay, so massage is this really umbrella term. It's like saying doctor. Clearly,
or chiropractor.
Or chiropractor. There are so many different meanings to the word massage, and massage at its most basic is hands-on manipulation of the body for wellness. Which,
I like that.
Yeah, pretty easy.
It has a good ring to it.
It's pretty easy to understand. Now, most of us, when we use the word massage, are thinking about the thing we receive in a spa where there's oil, lotion, soft music. And that is one version, just like a cardiologist is one version of a doctor. Not the only version, but it's the most common thing we think of.
Of course.
So massage to me is anything that's hands-on, intended to create wellness within another human being.
That was philosophical.
It gets
I like
quick.
that, but it's the easiest way to encompass what it is, right? Just like when, as a chiropractor, people think, oh, you just adjust people. But there's so much other things we do, and I know that we're going to get into that as far as Rolfing, but I think it's an easy way to do. I think most people have been to like one of those, you know, mainstream spas where you go in maybe 60, 90 minutes if you're really treating yourself. And dim lights, they just relax you, right?
Which has a lot of medical value to it. There's a lot of wonderful things that come from that. And hey, if going to Massage Envy does that for you, then that's great.
Well, let's peel back another layer. What is bodywork?
So bodywork is another sub underneath massage. So it is a form of massage, but it has a different approach to it, and it feels entirely different than the spa thing that you're going for. So in a bodywork session, we are more specific towards a target We're looking more to accomplish a goal within that session. So if you have a shoulder that doesn't move well, that may be our focus. Or if you woke up with a crick in your neck and you want to be able to turn your head and see in your blind spot, that could be our focus. It is no longer full body. It is much more narrow. It falls more under the deep tissue category of massages, where we're trying to create a deeper, more mechanical change within the system, within the region that we've put a goal on.
Yep.
In a massage, traditionally, the ones we think about in a spa, there's a lot of oil and lotion. That may not be the case in a bodywork session. Sometimes there is, but sometimes there isn't. It can be a little bit more like physical therapy, where we're really intentionally, systematically working on a specific region, and we may need some friction there, we may need some grip, so we don't use as much oil and lotion.
Yeah, it sounds like that's more customized based on what you're seeing, right?
Absolutely. And so in these bodywork sessions, I often have clients remain partially dressed so that we can get on and off of the table and we can assess. In a traditional massage, you're undressed, you're underneath sheets and blankets, which is wonderful. You get a cozy, nice relaxation massage. But if we're looking to change your neck range of motion, I might need you to sit up to do that. And it doesn't make sense to have you sit up fully naked and try that out while you're feeling a little vulnerable.
Understandable.
So bodywork sessions they're more systematic, they're much more focused, they're much more deep tissue, not pain, but deep intentions. They're partially clothed. They don't use as much oil and lotion often. And they're often more geographically focused. So if we're focused on getting a shoulder to move better, I'll work on your left big toe if that helps. But if your left big toe isn't going to help your shoulder, I'm geographically going to stay in the regions that do.
Yeah, so it's still based on what the client or the patient, what their goals are, right?
Yeah.
We're not attacking every single thing. And before we get into Rolfing, how I like to compartmentalize traditional massage and body work, I think of traditional massage as, hey, you kind of tell them where your attentions are, and the massage therapist focuses on those areas. With body work, just where you're feeling the symptoms or the tension doesn't mean that that's where most of the hands-on treatment is actually going to come from, because you're caring more about the cause of the tension and not necessarily where the tension is. Is that safe to say?
That's actually really fabulous that I've never considered it that way. In a massage, you as a patient tell me where to work. In a bodywork session, I tell you where the most potent place is to work.
Where your dysfunctions are.
Yes. Yeah, I like that. That's a really
Where are you messed up the most?
Yeah.
All right, so that was a good insight on traditional massage, body work. I really wanted to bring that up because I feel like body work's becoming more mainstream now, which is good. But really why I have you on is to talk about Rolfing, because that's what you specialize in, and well, maybe that's where you get the most joy out of your life.
Yeah.
I hope so, if that's what you do for a living, right? So take me through the history about Ida Rolfing.
Yeah.
Ida Rolf.
Yeah. So Dr. Rolf was, a pioneer, really. As a woman, she graduated from Columbia University in 1920 with a PhD, which was, in 1920, a woman graduating with a PhD. That's no small feat.
Yes.
She did research for Rockefeller Institute for 11 years and worked in a male-dominated community. So she was no academic slouch by any capacity.
Doesn't sound like it.
No. And in this, we have to put it in context to the era, right? To be working in the 1920s and 30s as a woman in research, in medical research, was a really big deal. And she saw some things within the field that she was a fan of and things that she was not a fan of, but nonetheless, she went over to Europe, studied over there, did some homeopathy, some yoga training, did some other things in Europe, eventually came back to the States, and there's a whole long story about how Rolfing was developed, but eventually she came up with this series, this protocol that she gave to a human body to create change and to create and facilitate better health, because she saw the direction that medicine was going and that it wasn't working well for everybody and that it wasn't efficient. So she created this protocol which worked really efficiently on reducing the pain and discomfort of her clients, and she began teaching that protocol. She began teaching this protocol in the 40s, 50s, 60s, and at that time the women's movement was still not very strong. So she taught primarily to men. If you were a woman who got taught the work, there was very specific qualifications. You had to be a certain size, a certain weight, you had to be a certain structure, a certain education level. This was not an easy thing for women to get into. And it got a very gruff reputation. Dr. Rolf was not a warm, cuddly person. She couldn't be. In the 1920s with a PhD, you couldn't be.
No. In a male-dominated field.
And she taught primarily to male physicians, to men of power in that time period, because she knew if her work was going to continue that she had to be pointed about who carried on that legacy. So Rolfing has a long history of being an aggressive therapy form, but if we look at the roots of it, we can really see that that was intentional from Dr. Rolf as a way of carrying on the work. Something now that we can soften a little bit since women do have some rights.
Yeah, absolutely. Wow. I didn't know all the backstory there, so, I mean, she was truly a pioneer within the field.
She really was. Fascia is a really big buzz term. She's the first person who really looked at this getting cut out of the body during her time at Rockefeller Institute and was like, why are we cutting so much of this away? It can't be for nothing. There can't be no reason for this.
Yes, everything's there for a reason, right?
Yeah, so she is really one of the founding people to say this tissue has some really strong importance within the human body. And Rolfing has a long history of being attached to fascia and the effect that we can have on that system.
That's awesome. Well, it sounds, you mentioned she studied abroad or traveled elsewhere, so it's almost like, well, her main teachings were in Western medicine, but also got a different perspective through Eastern medicine or traditional medicine, whatever the terms were back in the day. So was able to kind of morph the two within one kind of treatment modality.
Absolutely, and you see this, her traditional training was in biochemistry, and then her other training, she'd studied homeopathy and hatha yoga and some other osteopathy, traditional osteopathy, so not necessarily chiropractic, but bone setting and all of these different things, and I'm sure much more depth than what I'm fully aware of. And so she blends all of this together into this protocol of how do we look at a human, how do we see them, and with depth. She understood these are more than just tissues that we can cut out of a body. There's stretch to them, there's energy and emotion that impacts the structure, and so how do we formulate a hands-on approach that can really impact all the parts of a human, not just one of them.
Right, from head to toe, which goes into the series. So let's talk about, it was a great history lesson, let's talk about what a Rolfing session looks like, or what is that process, how does it start?
Yeah, so it's different for every single Rolfer. Every Rolfer has a little bit of a different flavor of doing things, just as a lot of chiropractors have different flavors of doing things. In sessions with me, I really want to understand what is it that makes you tick. We know pain is more than just painful. It changes who we are. It changes the things that we enjoy, the opportunities that we have in life, and even our identities to some level. So the first thing in a Rolfing session is I need to get a broad idea of who are you? What has this done to your life? What is your discomfort beyond just the mechanical, I can't lift my shoulder?
Right.
What does that mean? Why is that important to you? Some people might not be able to lift their shoulder and like it. That means they don't have to do housework. That might work well for them. For other people, that could be really detrimental to their career.
Yeah, when you have to identify those ticks or those driving factors, because everybody we see, when we ask them, you know, what do you want to get out of this treatment or this treatment plan? Of course, everybody says, well, I don't want to be in pain anymore. Or maybe I want to move better, but why? There's got to be something that's driving you to want to change these behaviors, right?
Yeah, absolutely. And at a deeper level, if if you have been so entrenched, if not moving your shoulder has meant something good for your life, meaning you don't have to do the housework anymore, you've been able to get out of family obligations, or this is curtailed, and while it's uncomfortable and you don't want the discomfort, you like the result of the discomfort, the things that has given your life, the chance that we can reduce your discomfort is greatly limited. And so I can tell just by this process of intake and understanding a little bit more about the human and what drives them, is it realistic that we're going to be able to create change?
No, absolutely not.
Sometimes not.
Well, and it depends on if they want those things changed too. So that's why it boils down to there's not a one size fits all. And we'll probably have a whole different podcast discussion on pain science, because it's hard, especially doing what you do, it's hard not to go into those realms, because doing like Rolfing and what you do, it isn't just go in, get the treatment, feel better. There's so many layers to the onion of what you do, which is why you're a great referral source.
For some Rolfers, it is as simple as go in and receive a treatment. I have, for my own injuries, received that type of therapy and watched it fall flat because nobody addressed the deeper things. So in my perspective of Rolfing, I do want to look at the layers of the onion and understand.
You go right to the core.
Yeah, let's get deep in this. Let's get philosophical right away.
Let's get messy.
Yeah, is this pain working so well for you that we're actually not going to create any change? All right, well then I don't feel successful. You say Rolfing doesn't work. Let's just not even do that.
Mm-hmm. Well, and you don't want to waste anyone's time. You don't want to waste your time. You don't want to waste the client's time. So what about just a black and white, if that's even possible, Rolfing session? Because we define traditional massage, we define body work. How would you describe what you do with Rolfing specifically within a session?
Yeah, so Rolfing, I think the easiest way to define it and make sense of this is Rolfing is body work. We're just using a specific logical protocol, going in order throughout the body. We have a checklist of things that we're going to look at, and we start checking off the checklist. So in a bodywork session, I tell you what's tight. In the Rolfing session, we go, okay, well, your shoulder might be what's tight, but let's look at breathing first, and let's see what changing your breathing will do. Okay, well, let's look at your feet next and see how well your feet are supporting your body and how much that's impacting your shoulder tightness. Next, let's look at this thing, and we keep going down this list of let's see how these different areas impact that shoulder tightness. So we stop playing whack-a-mole with the shoulder tightness, and we start getting much more logical and systematic about it, and that's one thing that's very different about Rolfing and bodywork sessions. So Rolfing uses the same techniques, the same principles as bodywork. It often feels the same, but it is far more logic-driven and systematic in approach. And with Rolfing series, for me, I give you homework afterwards. I want to know if you start changing some lifestyle factors, are we going to see even more of a catalyst, even more of a change? This Rolfing session should be a catalyst. Yeah. How much can this create? How much can this inspire you to take on and do in your own life? Whereas bodywork sessions are a little more just, let's work on something and send you on your way and see how it goes.
Make you sweat a little bit.
Yeah.
Well, and the big thing is changing behaviors, because I always tell someone that's like, oh, you got a massage therapist here? Like, should I see her? Or, would that be good during, what we're doing here? And I'm like, of course. But it's not just go there and, you can do relaxing massage, but I know that's not where your passion is, where you actually want to solve problems, right? Where I'll say, hey, she could do traditional massage and find out where your tension is, but she's really the massage therapist equivalent to what we do as far as combining physical therapy and home stretches so you can change your behaviors. And we've co-managed a lot of people. Yeah. If you can combine both of what we do,
it's gold.
Man, it is pretty efficient, I must say. But I think that's a good way of putting it where, hey, you're going to have to do some work. If you really want to change how you feel, you have to change the behaviors or just what you do to not have that keep manifesting over and over again.
Real change takes change.
Cliche,
but...
You can't just take it away?
I wish. Right, if you keep doing the same behavior, if you keep standing in a very imbalanced way that makes your low back contract to stabilize you, I can do a bodywork session and consistently give your low back some more flexibility, but if you keep going and standing in a way that tenses it, what are we really doing?
It's just picking the scab.
And we keep repeating the same thing over and over again. I don't feel particularly successful when you come to me every 2 weeks, every week, whatever, and we're repeating the same battle. That's the definition of insanity.
We're all a little insane. But yes, we want to limit it as much as possible.
Right, and so, hey, if you're the person who doesn't have the space in your life to make changes to behaviors, gosh, as a new mom, I get that. Like, you don't always have the bandwidth to make those changes within your life. You're just floating to get through. That's fine. Rolfing's not the thing at the moment. But if you are like, I am done dealing with this, real change takes change. Let's start cultivating some behavioral and some lifestyle skills, some stress coping mechanisms in order to better handle how our physical body reacts to our behavior, our emotions, and our outside world. Amen.
Preach. So, Kristin, I kind of already know this answer, but I work with you. Who would be a good Rolfing-specific client?
Yeah, Rolfing-specific clients, at least for my office. And this because this is different for every single Rolfer, and we all have a different flavor, just like each chiropractor is a little different. So I'm going to limit to what's good for here. The best clients for me are people who are interested in making real changes in their lives. They recognize the way they're doing this isn't working. They've had the same repetitive pain. They've tried physical therapy. They've tried more traditional chiropractic, and it's just not yielding the result that they were hoping for. They've done deep tissue massages, and they feel like if they don't go every couple of weeks, the tension returns. They've done relaxation massages, and while they're nice, they're not providing sustainable changes. So people who have tried lots of therapies, they haven't really worked successfully long term, and they're interested in changing behavior and lifestyle in order to cultivate more sustainable changes within their body.
I think that was perfect. And for my clinical practice, if I hear a patient, if I'm just starting to work with them, and they mention they've been with, let's say, 4 or 5 plus providers for that condition they're coming in for, you bet your butt that I'm trying to talk them into seeing you simultaneously. Also, I think that was a really good rundown. Of course, I'm going to have you back on here, and maybe pain science concepts would be huge. Because if anyone's actually been listening to this, I think they can tell you're more than just an LMT that rubs tight areas, right?
Yep.
At least you hope so.
If that's not obvious already, I'm pretty nerdy.
Yeah, we get into the weeds all the time, which I think that's why it's hard for us to do it within a specific shorter amount of time. So let's lead off with one more time. How can people reach you? Again, your company name, and then we'll...
So I'm Kristin Szlinis. I own Wise Body Solutions. We're located within Reach Rehab and Chiropractic. You can find us online at wisebodysolutions.com or on Instagram and Facebook under Wise Body Solutions.
And cut.